Hello guys, ako nga pala si Nurse Clyde at kasama ko ngayon si Nurse Barbie. Kaway ka naman dyan, Nurse Barbie. Hello. As you can see, meron akong alcohol dito at meron akong mask. Kasi nga, alam niyo naman na ang kumakalat ngayon na coronavirus, kailangan nating mag-ingat at laging mag-alcohol at wag dapat pumunta sa mga matataong lugar. So, ngayon, pag-uusapan natin ay about sa gamot. At ang gamot na ito ay Famotidine. Nakita nyo ba? Famotidine. Yan. So, ano nga ba ang Famotidine, guys? So, ang Famotidine ay histamine 2 or H2 receptor antagonist or blocker. So, famotidine is an oral drug that blocks the production of acid by acid producing cell in the stomach. So, it belongs to the class of drug called histamine 2 or H2 blockers, yung sinabi ko nga kanina. And bakit nga ba H2 blocker? So, because histamine is a naturally occurring chemical that stimulates the cell in the stomach to produce acid, and excessive stomach acid can damage the esophagus, stomach, and the duodenum. So basically, histamine 2 blocker inhibits the action of histamine on the cell, thus reducing the production of acid. So yun nga. So iba-iba ang brand name nito at merong Apo Famotidine, Novo Famotidine, and ang pinaka sikat na brand nito ay ang Pexid. So yun, Pexid. So hindi naman na importanteng malaman nyo yung brand name, basta yun, Famotidine siya. So ano naman ang indications nito? So this is for use for short-term treatment and maintenance of duodenal ulcer, yung sabi ko nga kanina, kung merong ulcer, and then short-term treatment of benign gastric ulcer, treatment of pathologic hypersecretory condition like Zillonger-Ellison syndrome, and short-term treatment for GERD or gastroesophageal reflux disease or esophagitis, and it relieves the symptoms of heartburn, acid indigestion, and sour stomach. And for the dosage naman, for adults, for acute treatment of acid duodenal ulcer, it should be given 40 mg or IV or 20 mg twice a day. And therapy at full dosage should generally be discontinued after 8 weeks na. And for maintenance therapy for the duodenal cancer, it should be 20 mg at bedtime. And for benign gastric ulcer, it should be 40 mg daily at bedtime. And for GERD naman po, should be 40 mg for up to 6 weeks. For patient with esophagitis, the dosage is 22 mg twice a day for up to 12 weeks. And for heartburn or acid indigestion naman, it should be 10 mg for relief, and 10 mg 1 in every hour before eating for prevention. And for pediatric patient naman po, so 1 to 16 years old, for peptic ulcer, it should be given 0.5 mg daily or divided into 2 dosage of up to 40 mg per day. And for GERD naman po, with or without esophagitis, it should be 1 mg per day and divided into 2 dosage of up to 40 mg twice a day. So for contraindications, it is contraindicated for hypersensitivity, lactation. And what are the adverse effect naman? The adverse effect of famotidine is headache, dizziness, constipation, diarrhea, nausea, rash, GI discomfort, fatigue, gynecomastia, and impotence. So, what are the nursing responsibilities? So, for the assessment, history taking is very important. So, uh, history of allergy to famotidine, renal failure, lactation, pregnancy, and hepatic impairment. And for physical assessment, assess for lesion, liver evaluation, abdominal examination, normal output, renal function test, serum bilirubin. And for interventions, if using one dose a day, administer drug at bedtime, no, and decrease. It should be for patient with renal failure. The dosage should be decreased, and arrange for administration of concurrent antacid therapy to relieve pain, and reserve IV use for hospitalized patient not able to take oral medications, and switch to oral medication as soon as possible. And for the health teaching naman po, so take this drug at bedtime or in the morning and at bedtime. So therapy may continue for 4 to 6 weeks or longer, and place rapidly disintegrating tablet on tongue and swallow with or without water. And take antacid exactly as prescribed, being careful of the time of administration, and have a regular medical follow-up on the drug while on this drug to evaluate your response, and take over-the-counter drug 1 hour before eating to prevent indigestion, and do not take more than 2 per day. And you may experience this side effect: constipation or diarrhea, loss of libido or impotence, and headache. So it is very important to teach our patient about this, and report sore throat, fever, unusual bruising or bleeding, and severe headache, muscle, or joint pain. So that's all for today, and hope you enjoy this video, and thank you guys for watching. Bye bye.